if I am correct, we had talked about the thyroid gland last. We talked about how the pituitary releases thyroid stimulating hormone, which is called TSH. That causes the thyroid to release its hormone, which is thyroxine. And that thyroxine helps the metabolism keep going in a balanced state. The thyroid is a butterfly-shaped gland. It's located right underneath your voice box, which is called the larynx. If you have an underactive thyroid, it's called hypothyroid, and an overactive thyroid is called a hyperthyroid. Now, for a person who has hypothyroid, they're likely to gain weight, feel cold all the time. Seems like you can't get warm. I think I told you that when I was in grad school, I was wearing a t-shirt, a shirt, a sweater, and a parka, gloves, and the hood up, asking them to turn the heat up because I was still cold. I could not get warm. Decreased energy, increased fatigue. They may complain of joint pain, and then also you'll see a lot of hair loss. And I'm not talking about just a little here or there. You'll look down, you'll see significant hair that's in the basin or in your tub. Well, a person with hyperthyroidism, the ones that I have known usually are thin. I don't want to say weight loss, but they really appear thin to me. And they will have bulging eyes. They're called either frog eyes or fish eyes, where they're bulging out of the kind of the socket. They are likely to have heart arrhythmias, which means an irregular heartbeat. Now, I was talking to the doctor one day, and I said, well, if having a thyroid not put out enough thyroxine caused me to gain weight, couldn't you double the amount of thyroxine that I'm taking right now? Maybe that would help me lose weight. And he said, the idea is right. He said, you got the gist of it, but because the thyroid is sensitive to that, if you would double it, you'd also have the chances of start developing irregular heartbeats and having a heart attack. So he goes, I don't think I really want to do that. We talked about free TPO, did we not? Yeah, that's right. And that leads us to where we're going to start up today, the pancreas. Pancreas is a gland that secretes insulin. Insulin is a hormone from the pancreas. Now, there are things that can happen to the pancreas that can interfere with the proper amount of insulin being released. If a person has a tumor in the pancreas, pancreatic cancer, an infection. Alcoholics have a high incidence of pancreatitis, infection or inflammation of the pancreas. If you were to have say a person that might get into a fight or an automobile accident and they suffer a big blow to that area and injure the pancreas, that can cause problems. But by far, the most common reason that the pancreas does not secrete the proper amount of insulin is a disease called diabetes. Now, diabetes, I guess you could almost say it's an epidemic proportion in our society now. It is so common that people don't take diabetes as seriously as they should. Now, I'm going to tell you, I don't want any volunteers or anything, but I can guarantee you that from my experience, I would say that there's an extremely high likelihood there's a diabetic in this group. That's how common it is. Now, diabetes, it used to be in the high causes of death, but now it is linked to associate causes. Like when you have diabetes, your risk factors for stroke goes up. Your risk factors for heart attacks go up. And so now you've got these extra problems. And so, we've got diabetes, and then if somebody has a heart attack, they don't say the person dies of diabetes, they die of that heart attack. Diabetes is an inability to control or regulate the blood sugar in the body. Now, it's caused from an underactive pancreas or a pancreas that does not secrete any insulin. A person can have diabetes and have a low functioning pancreas. It is a very, very dangerous disease. People are not taking this serious enough. When a person has diabetes, they are at risk for developing eye problems that can cause blindness, like I think macular degeneration. I believe that can be caused from diabetes. Retinal detachment. That's two things. When you get diabetes, you are automatically at a higher risk for heart attacks. Doesn't matter what your age is. You're automatically increased in your risk factor. You're automatically increased in your risk factor for strokes. It affects the kidneys. It also affects the nerves and the brain. There is a problem called neuropathy. Now, neuropathy is when the endings of the nerve die. And they don't function anymore, so therefore the area they were supplying becomes numb. Okay? So, before it becomes numb, it can become very painful. And then there's numbness. When a person is diagnosed as diabetic, one of the things the doctor ought to be doing is really, really emphasizing foot care. Very often, the neuropathy will hit in the foot or in the feet. And as the disease progresses, they have less and less sensation in their feet. Okay? Now, let's say you've got this person and she is really very fashion conscious. Well, she gets some shoes that are just absolutely, they are the bomb. They are the trendsetter for fashion. She wears them to work and styling, profiling, and everybody is complimenting those shoes. They are smooth. She is just eating it up. But, see, she doesn't know that she has neuropathy in the feet. And she doesn't realize that as she is wearing these, that they are a little bit too tight, and every time she takes a step, there's friction on one of her toes. Okay? So that night when she gets home, she doesn't know that she has a blister. She doesn't feel it. Well, she says, if I got this many compliments today and I got to go to a different group tomorrow, I'm going to wear the same shoes and just eat up those compliments. She wears the same shoes. Now, that blister is getting that friction, right? And it's between the toes. It bursts. Now she's got an open wound, right? And she doesn't know it. She doesn't feel it. Well, along with being very fashion conscious, she's very health conscious, and so she goes and she works out. And she works out at this gym, and then when she gets finished, she showers in the same place that everybody else is showering. And on the bottom floor of the shower, everybody else's feet has been there, and she picks up some bacteria that gets into their blister. She doesn't know she even has a blister. It gets infected. It's red. It's oozing. She doesn't know it. She doesn't feel it. Pretty soon, the shoes start feeling a little uncomfortable, like she can't try and get the feet in like she should, and she realizes her foot's swollen. And she looks and she sees a real red area around the toes, and she looks between her toes and she's got a massive infected area. She goes to the doctor and she said, I don't know what happened. And he said, my gosh, he goes, you have got a serious infection here. And so he treats it, and he gets some of it, but it's not healing like it should, because see, a lot of times diabetics don't heal like they should. And he said, well, I think probably you're not healing because you are diabetic, and so we'll keep on treating it. He doesn't realize that there were 2 bacterial infections, and he only treated one of them. The other bacterial infection sets in. It's more and more serious. And worst thing comes to worse, she develops an infection called gangrene. The doctor sees this and he says, oh my gosh. He says, this is now a life-threatening situation. He says, it started at the toes, but because gangrene moves so fast and it can kill so fast, we're going to have to try and take your leg at the knee and try and avoid having that spread any. So they amputate above the knee. And she now has one leg that has to have a prosthetic. That is not an outrageous example. Diabetics are notorious for having to have limbs amputated because of neuropathy. This is a very serious disease. When I say we don't take it serious enough, I have a friend of mine, he's got diabetes, and he's got a pretty healthy case of diabetes. He goes to a restaurant, he orders his meat, his vegetables, loads up on the bread, has a potato. He's Samoan, so he's a very large guy. And he says, well, I'm still hungry. I'll take a piece of that dessert over there. And you say, man, hey, you're diabetic. You need to be watching your diet. That's all right. I'll just give myself some extra insulin tonight. That's not the way it's supposed to work. You're not supposed to have highs and lows and highs and lows. You're supposed to try and maintain a regulated blood sugar. And so he's at risk for many, many problems handling his diabetes that way, okay? So, diabetes, very serious. When a person has diabetes, there are 2 conditions that they have to be careful of. One's called hypoglycemia, a low blood sugar, and hyperglycemia, when their blood sugar is too high. Now, a diabetic should maintain a blood sugar, if they are really in good control, they should have a blood sugar somewhere between around 90 to 110. That's really normal for all of us, between 90 and 110. If they can maintain it, say from 130 below, that's pretty good control, okay? Now, if their blood sugar starts falling below 70 or 80, they're going to start feeling symptoms. Now, these symptoms can be anything from starting to complain about a headache. You've heard of a hunger headache? Hunger headaches are because your blood sugar is getting low. And so, as lower your blood sugar gets, the more your head hurts. They can become very irritable. Very irritable. They can have confusion. They can, their heart may start pounding, and they can start sweating profusely. And they can become panicky. The hungrier they get, the lower the blood sugar, the more panicky they're going to become. Let's see, they can start trembling, shaking. It can actually affect their vision and cause their vision to change. It can actually cause a personality change as they are experiencing this low blood sugar. My mother was a sweet, sweet little Southern belle. 4'10", the most pleasant, loving person you ever saw. Whenever she was in the hospital, the doctors and nurses said that she was the best, that they actually looked forward to her coming because she was such a wonderful person. All my friends loved her, called her Mama Wright. Just a sweet lady. We went to the doctor one time, cardiologist, and he told us not to give her anything to eat before we came to the office because he wanted to do some blood work and didn't want anything to interfere. Well, we got there and he had an emergency, so he was gone for a while, and Mother is sitting there in the room, and she's looking around and such, and she goes, I'm getting a little hungry. I haven't had anything to eat yet. And I said, I know, Mother, but he'll be here soon, and as soon as he gets here, he'll tell him what labs he wants, and we'll get you taken care of. A few minutes later, I'm really getting hungry. I'm starting to really feel the need for some food. And I said, well, Mother, if you can hang on just a few more minutes, I think we got it. Sometime later, a nurse comes in. This nurse knows my mama because my mama went in there at least once a month. And my mother tore into that nurse. She said, I cannot believe that you all are so inconsiderate to have me sitting here, a diabetic, not having anything to eat, and I'm sitting here and I'm hungry and I'm tired of waiting. I'm tired of this inconsideration. I'm tired of the doctor putting me off. And she went off on that nurse. And that nurse kind of looks at me, and I said, she's been complaining about being hungry. And she goes, let's get a blood sugar real quick. Her blood sugar was about 50. And they said, oh my gosh. They came running in, and they gave her some cookies. And she was, and she goes, that's really great. Now let me have some food. And they said, well, we're going to get you a Coke real quick. And so, she downs the Coke, and she goes, that's nice, I want some food. And they were robbing everybody's lunch boxes to try and figure out, something to give her. She finally settled down, and her blood sugar came up. And then she was just profusely apologetic. I am so sorry. I don't know what got into me. That was so rude, and I said some very horrible things. Please forgive me. I'm so sorry. And they said, we understand, Miss Sarah. Your blood sugar was really, really low, and we should have been careful about that, And so blood sugars can cause personality change. They can cause a normal person to be extremely panicky and gotta have that food. A high blood sugar, well, the first thing that they're probably going to do is start complaining of a immense thirst. I cannot get enough liquid. And they will be downing that water. Now, I've been associated with medicine for over 25 years. Worked at hospitals, worked in the ambulance. I had a mother that was diabetic. I've been an EMT instructor. I have never known anybody who had a high blood sugar and was hungry. I had some diabetics 5 or 10 years ago, and she said, whenever I get a high blood sugar, I'm always hungry. Everything she described was really a low blood sugar, but she screamed, no, it's a high blood sugar. I know that I run a high blood sugar. Okay, but normally they're not going to complain of being hungry. They're going to really, really want a lot of water, a lot of liquid. They cannot satisfy that thirst. If they take in a lot of liquid, guess what they're going to do? They're going to go to the bathroom. And so they're going to have increased thirst and increased urine output. Okay? Now, one thing about my mother, whenever her blood sugar would get high, she would get blurred vision. And so it too can affect your vision when you get a high blood sugar. They will possibly have very heavy, labored breathing. Okay? And for the person in here that is diabetic, this is not meant to be hurtful or embarrassing or rude in any way. But if a diabetic runs a high blood sugar for a sustained time, they will develop a very distinctive odor. It's a musky, sweet, very, very sweet odor. It's almost like fermented fruit. And because of that, many diabetics have been thrown into jail as a DWI. Why? Because when you get a high blood sugar, you can also become very confused and disoriented. You have somebody that's driving, confused, disoriented, they pull them over, they smell fermented fruit, they throw them in jail. This is not as common now as it used to be because we've got a lot more knowledge out there. We've got breathalyzers, we've got things that can nip this in the bud, and also diabetics are becoming more freely admitting they're diabetic when something like that happens, if they are cognizant enough to do it. They can become very sleepy when they have a high blood sugar. And both of these, high and low, if it gets too extreme, it can cause a loss of consciousness. Now, my mother got the flu. I took her into the doctor, and on the way to the doctor, we had to take an elevator up to his office. Mother was too weak from the flu to walk, so I had her in a wheelchair. And she was sitting in this wheelchair on the elevator, and the next floor, a gentleman got on and stood beside us. And Mother, sitting there like that, and she goes, "Mr. Lincoln, you are my favorite president. It is such an honor to meet you, and thank you for what you did for our country. You are the greatest, and you made the supreme sacrifice, and it's such an honor to be in your presence. Thank you, thank you." And this guy's kind of looking at her, you know. And I'm not knowing what's going on. We get up to the doctor's office and I tell him what's going on. He said, let's take her blood sugar. She had not had any insulin that day because I didn't know what, at that time it was pretty new to it all, and I didn't know what to do when she got the flu. And when she got to his office and they took the blood sugar, it was 700 and something, it's like 750. And he said, oh my gosh, he goes, most people would be unconscious with it this high. And so immediately they started working to get the blood sugar down. And I'm amazed he didn't hospitalize her. But they got the blood sugar down before she left the office. And then he told me, you know, what all to do and to help her and such. But here, a little bitty 4'10" lady is convinced that Abraham Lincoln is standing beside her. I mean, that's some real confusion, okay? The person who has a high blood sugar may have hot, dry skin. They're not going to be sweating, okay? They can complain of being weak, and they might even complain of some abdominal problems. So, high blood sugar, extreme thirst, frequent urination, dry skin, X off the hunger. I haven't seen that one. Blurred vision, drowsiness, and nausea. Hypoglycemia, trembling, shaking, fast heartbeat, sweating, anxious, panicky. They can complain of being dizzy, extreme hunger, impaired vision, weakness, fatigue, headache, and irritability. When a person is diagnosed as a diabetic, they're going to live in a triangle, or with a triangle. The doctor will say, you know, he should interview them and find out about their lifestyle, find out about their diet, find out, you know, what their usual day is, and they will normally, many of them will order a consultation with a dietitian. The diabetic will then start living, especially if they are on insulin, they will start living their lives in a triangle. If you change any one of these things, you are going to change the blood sugar in the body. So, I had a student come to work one day, I come to school one day, and I saw him in the back of the room, and he kind of looked funny, and he pulled out a little blood sugar kit, took his blood sugar, and then just kind of, you know, and I saw him pull out a needle and give himself some insulin. After class, he came up because I want you to know I wasn't shooting up or anything. I said, I know that, you know. He said, when I left this morning, I thought that I ate. And, wait a minute, hold on. Said, when I left this morning, I ate breakfast, and I thought I took my insulin. I could tell something didn't seem right. I took my blood sugar and I realized I forgot to take my insulin this morning. And so I had to take it real quick to start getting it down. I said, that's fine, no problem. I had another guy come to class, and he fell out and lost consciousness in my class. And the ambulance was called, and when he came back to class, he told me, says, I am so sorry. He goes, I got up, I took my full dose of insulin, I got dressed, I realized I was running late, I left, I didn't eat my breakfast, and he said my blood sugar bottomed out, and that's why I collapsed and fainted. Here, they had the food, but no insulin, and so he had a high blood sugar. Here, he had the insulin, but no food. So his blood sugar bottomed out. So you can see either one of these affected the blood sugar. Now, exercise affects the blood sugar. I saw my mother get up one morning. My mother was really sharp about the blood sugars and the insulin. She understood it really well. She got up one morning and she went into the kitchen, and I saw her come out, and she got a mop, and she started mopping the kitchen. And I said, Mother, what's going on? And she said, my blood sugar's a little high. She goes, it's not high enough, you know, to worry about or to think about anything extra there. But she said, I know that if I exercise, it'll bring it down. And so she decided to mop the floor, which was increasing the exercise that she normally would have. And because of that, it caused her blood sugar to drop. And so exercise can affect the blood sugar, okay? Now, two other things can affect the blood sugar that we need to talk about. One is stress. A person who has stress, it'll affect their blood sugar. Illness. If a person becomes ill, like the flu, a cold, different types of problems, it can affect the blood sugar. Okay? So, what next? What are the risk factors? One of the biggest risk factor is obesity. Probably the only thing that would be a bigger risk factor would be if it's family history. Obesity, ethnic background, Hispanics, Latinos, African Americans, Native Americans, Asian Americans, Pacific Islanders, Alaskan Natives, all are at a higher risk factor. But don't worry, the rest of us are catching up very quickly, okay? Family history. We never had diabetes in our family until my mother developed it. The day that she was diagnosed as being diabetic, all of our risk factors went up. It runs in our family now, and it has shown up now in some of my cousins. And so now we know that the family does have that propensity. Polycystic ovary syndrome. Age. Once you hit 45, you're automatically in a higher risk factor. The chances of getting type 2 diabetes increase with the more risk factors that you have. That makes sense. If you have vascular disease, such as heart disease, stroke, if you have a stroke, that's vascular disease, and that can cause problems. Metabolic syndrome. This is also called insulin resistance syndrome. Your body does not metabolize the way it should and does not utilize insulin like it should. obesity, high blood pressure, abnormal cholesterol levels. If you have a history of gestational diabetes, that means when a woman becomes pregnant and during her pregnancy she becomes diabetic. That sets it up later for life. Inactivity. Let's see, we've all covered all that. What are signs of diabetes? A change of weight. The way that we found out Mother was a diabetic was she dropped like 25 pounds in 3 months. And it was noticeable. It was very, a little bitty lady like that is pretty noticeable. And I got her in and said, we don't know what's going on. Well, she lost the weight. Some people might gain it, okay? Sores that do not heal. Diabetics have a problem having sores that heal well. When a person comes in and as they get older, they start developing a wad of fat right here, mid-abdominal, just like I've got, okay? They don't know if this is caused by diabetes or if this is something that triggers diabetes, but they do know this type of fat. It's not in the butt, not in the thighs, not in the wings, not in the lower abdomen. It's right here in the mid-abdomen. This is connected to diabetes. Then the doctors have what they call the 3 Ps. Polyphagia, polydipsia, polyuria. Polyphagia, an increased hunger. If you come in and say, doctor, I'm just hungry all the time, I can't seem to ever get satisfied. That's polyphagia. Polydipsia, an increased thirst. You can't get satisfied with your thirst. And then polyuria. Drinking a lot of water, you're going to have an increase in urination. Now, if you have diabetes in your family, if you are a diabetic, please pay particular attention to what I'm about ready to say. There is a test called a hemoglobin A1C. This is a diabetic's best friend, next to insulin. It's called an HA1C. Now, let's say that you have diabetes in your family and you've heard this lecture and you go to the doctor and you say, doctor, I'm worried because we've got diabetes in our family and I'd like to make sure that I don't have diabetes. Chances are he's going to give you what's called a fasting blood sugar. A fasting blood sugar is absolutely useless in diagnosing diabetes. A fasting blood sugar gives that doctor a picture of what your blood sugar was in that 1 second of time. The very second that they ran that blood sugar. It can be affected by all kinds of things. It can be affected by what you did the night before. It can be affected if you forgot and you had some cream in your coffee. It can be affected if you took the steps instead of the elevator. All these things can affect the blood sugar if it's a fasting blood sugar. The hemoglobin A1C is a blood test that tells the doctor how your blood sugar has been running for 3 months. It gives an average of the way that the sugar has been metabolized. And so, instead of seeing a snapshot of 1 second, it tells the doctor what's been going on for 3 months. It averages it out. The numbers run, I know they go from at least 1 to 12. I think they go at least to 15, but I'm not sure about the 15. Normally, you want a blood sugar below 6, or hemoglobin below 6. Anything below 6, the doctors are pretty happy with. When it starts getting above 6, then they start looking and seeing if you have a problem, okay? You have to be an advocate for yourself. I love my doctor. He is fantastic. And when he first started practicing, he had a nurse that she may have been born and raised in Hades, because she was just not not a patient-friendly nurse. He and I had a regular routine about once every 3 to 6 months running an A1C. I came in for my appointment, and after we talked and such, he ordered up a blood test. And when he left, when the nurse came in, I said, "Oh, dadgummit, I forgot to remind him I need that A1C." And she goes, "Are you diabetic?" And I said, "No." And she goes, "Well, then you don't need one." And I said, "Well, we run this regularly because of my family history." "Well, he's not going to order that, because if you're not diabetic, you don't run an A1C." And I said, "Well, if you don't mind, would you ask him? Because I think that he'll go ahead and order that." And she goes, "I work for him. I know this man. He is not going to order an A1C when you're not a diabetic." And I said, "Please humor me. Please go ask him to order A1C. Ask him, tell him I asked if I could have that A1C." She goes, "I'm going to do it, but it's not going to work. It's not going to do it." And she comes back and she goes, "I can't believe it. He ordered it." Well, I had to be my own advocate. I had to take a stand and say, "Look, I know what's best for me. I know what the doctor and I do. And if I have to go past you, I will. But you have to be an advocate for yourself." Okay? My watch is off. All right. With that said, very quickly, talking about the gonads. Men, it's basically the testes, women, the ovaries. Now, we're not going to get into anything except 2 things. First of all, men have more testosterone than women. Women have more estrogen than men. But both sexes have both hormones. Men do have estrogen, women do have testosterone. Another case to be made of why we are teaching this chapter and talking about the endocrine system and psychology. I had a lady come in one day and she said, "This is my last stop before divorce court." And I love it when they put that kind of pressure on you, And I said, "Well, what can I help you with?" When I got married, my husband and I had a phenomenal sex life. I mean, we couldn't stay off of each other. And she said, it was great, fantastic. And she said, "I can't stand him now. I don't want him to touch me. I have no desire whatsoever for sex. I certainly don't enjoy it. I don't look forward to it. I just have 0 sex drive." And so, as a therapist, I went through the normal questions. Has something recently happened sexually that has bothered you? No. Were you ever abused sexually? No. Were you raped? No. Has somebody have you had rough sex in the past that got out of hand? No. Have you ever gotten into S&M? No. Completely unremarkable history. Nothing in her history. Perfect childhood. Perfect this, perfect that. No trauma here, no trauma there. Absolutely nothing for me to grab onto. I went to our psychiatrist and I presented the case to him and I said, I don't know what to do. I don't know where to go. I am stumped. And he looked at it all and he said, you get her to the lab and get a testosterone check. And I said, testosterone? He said, yep. He goes, she's got a critically low testosterone. Sent her to the lab, had a lab draw blood, ran the testosterone. It was a critically low testosterone. We started putting her on testosterone supplements, well, shots. And it was amazing how things started improving. And about 3 or 4 weeks later, the husband came up and thanked us profusely. And last time I heard from her, she sent me a card from Hawaii saying they had moved to paradise, they were living the dream, and everything was going great. That shows you that biological psychology has a place. There are times that there is an organic cause for a problem. When that occurs, then there needs to be a response, a medical response, okay? One other thing, men and, well, there is a substance called pheromones. And pheromones is a chemical that's excreted that has an effect on another organism's behavior. Okay? Now, normally we associate pheromones with animals. We know that pigs secrete pheromones, and that causes the male to go crazy and start the mating ritual. We know snakes emit pheromones. I don't know if you've ever heard of a snake ball, but like I know that water moccasins get in what's called a snake ball, and there'll be like 100 writhing snakes in this massive ball, and they're just going to town mating, and part of that is caused by the pheromones. We know dogs secrete pheromones, or excrete them. If you have ever wondered how a male dog can sense a female in heat from miles away, that's part of it. But even more so, it's a fact that if you have an adult female dog and you have a puppy female dog that's around 4 months, maybe a little at 4.5, if this one goes into heat because of the pheromones, it'll cause this puppy to go into heat earlier. Insects excrete pheromones. When you get stung by a wasp, it excretes pheromones, and the others perceive that, and that's why they'll start swarming on you. And every time that they hit you, more pheromones are being released, and that's part of that frenzy. All of those things secrete or excrete pheromones. So the natural question is, do humans? And we say we're almost positive humans do. It hadn't been absolutely proven. But one of the things that lead us to believe it does, or that humans do, is a thing called menstrual synchrony. If you get women that work in close proximity with each other, very close proximity, or if you have women that live in close proximity, like a dorm or a home, home and such as that, the women's cycle will tend to merge and they will start cycling at the same time. That is called menstrual synchrony, and they think that is caused by pheromones. I still can't get this thing to turn on. What is wrong with that? adrenal glands located on top of the kidneys. On top of the kidneys. You have the adrenal medulla and the adrenal cortex. The adrenal medulla secretes epinephrine and norepinephrine, used to be called adrenaline and noradrenaline. The norepinephrine is used in fight or flight. It's what is used in the body to rev up the body in fight or flight. All right, now, the adrenal cortex, it secretes glucocorticoids, which is used in producing glucose. Now, let me see something real quick. Okay. I'm going to, I've said everything I want to say about the adrenals, but I'm going to take a couple of minutes to talk to you all about steroids. Steroids are an extremely dangerous substance. Even when doctors are managing it, it is extremely dangerous, okay? But they know how to manage it, and they know how to regulate it so it reduces the risks. Now, what I'm about ready to say is about this new fad of roids, where they're taken for different reasons. One reason is so that the guy can bulk up, look like a hunk. Another reason is so that it enhances the athletic performance. And the third reason is it will speed up the effects of working out. None of those are good reasons for taking steroids. They're therapeutically very good. Prednisone is probably the most famous steroid. Now, if you've ever taken prednisone, I'll illustrate how dangerous they can be. They will give you a packet. You'll start out with 6 the first day, 5 the second day, 4 the third day, 3 the fourth day, 2 the 5th day, 1 the 6th day, and they usually, sometimes they'll even have you skip a day and take the last one because they have to titrate it down. I had a housekeeper that was diagnosed with lupus. They put her on prednisone, on a regular prednisone to try and keep the inflammation down for the lupus. She gained 75 pounds in 6 months. This stuff is not, it's got some good therapeutic uses, but it's also dangerous. Now, when a person takes steroids and not under a doctor's care, here are some of the things that can happen. They can develop major depression. That depression can go to a point that they become suicidal. Steroids are addictive. They are very addictive. If they take too many, too long, they can become, and too much, they can become very aggressive. And along with that aggression, they can have more strength and power where it can become more dangerous if they go off. It can affect the moods. It can cause wide mood swings. It will affect blood sugar. When my mother broke out in hives from the top of her head to the bottom of her feet, the doctor put her on prednisone. It was a different doctor than she normally went to, and he said, well, this can affect your blood sugar, so you need to go back to your PCP and get him to monitor your blood sugar while we have you on prednisone. And when she got there, a week later, her blood sugar was well over 500, and she was not a diabetic at that time. They think that that is what threw her in. She may have probably been a borderline, and when they put her on that prednisone, like they did, and they kept her there, she never came off of being a diabetic. It can cause psychological and behavioral problems. It can cause high blood pressure. It can interfere with blood clotting. It can affect the liver where it causes a person to become what's called jaundice. And that's where they have a yellow or orangish appearance. It can cause tendon damage, reduced fertility, enlarged breasts in males, testicular atrophy. That means that the testes are going to shrink and shrivel. And then acne, particularly on the back and on the butt. Now, if you know somebody who is taking steroids to look real sexy and bulk up, be a good hunk, get them to think about this. You found a nice little lady, you all have gotten to know each other, and you've decided to become intimate. You take off your clothes, you've got man boobs, shrunken testicles, and acne on the butt. That is not a sexy picture, okay? So, there are better ways to impress a lady. Any questions? Any questions? Now, I think I told you to have everything done by tomorrow on this chapter as far as the chapter test, correct? I said the 28th.